Good morning, everyone. We are here to talk about Soraya and her problems. She's a beautiful girl and has a wonderful owner who noticed that she had some issues walking, and even to the point where she couldn't stand up. When we came in to see me initially a couple days ago, probably about a week ago now, we had evidence that there were problems with the back part of our neck and our cervical spinal column, which unfortunately, as Dobermans go, one of the more common things we find is a disorder called Wobblers disease, or cervical vertebral instability, malarticulation, malformation. So we discussed pursuing an MRI to see what's happening in the spinal cord and make better judgments. How do we go forwards? Because Wobblers disease is a very complex disorder. When we did an MRI of Soraya's neck, we have a few different changes. Congenitally, the 6th and 7th bones in our neck are actually fused together. So here's a side picture of our neck, and then these are going to be cross sections cutting through to look from left to right. So brain is up here, 1st, 2nd, 3rd, 4th, 5th, 6th, and 7th bones, and then we're back into our ribs, into T1, 2, 3. And so these bones are fused, and that can cause some problems as it changes the biomechanic forces on everyone adjacently. Because now that there's not the ability to move and manipulate, these bones being fused put extra pressure forwards and back. And that's actually caused the biggest problem for Soraya. So between C7 and T1, the bones are a little bit tipped because they're under different stresses, and it's caused this disc below to bulge upwards and press on the spinal cord, leading to further compression. At the same time, because of the instability and that malarticulation, the joints around have started to grow inwards. So we get compression to the spinal cord from the bottom, we get compression from the top sides, and even the ligaments above at multiple spaces are growing inwards, so you have 4 different angles where the spinal cord is being squeezed from. So here we have on the bottom, it's a cross section through the spinal cord. The spinal cord is right here in the very middle. And this is behind the problem. We're going to walk through it. Spinal cord already is a little bit abnormal. And I think on this video I'll try to make it as big as I possibly can so you can see it across the room. Normally spinal cord is completely round, but this one has taken on kind of a compressed triangular shape. And as we work our way through we can see underneath there's a large amount of compression from underside. And inside the cord there's actually brightness. It's hyper intense. And that indicates to us that the spinal cord is bruised or contused, or it hasn't had the proper oxygenation from this chronic compression that's there. As we get up even further, the joint on this left side has bulged inwards, the disc underneath is bulging upwards, and we have that hyperintensity inside. And then as we work our way through, things come back to a much more normal appearance. And then as we keep going upwards, oh, that's really big. That's a much more normal spinal cord. That's what we want to see. The joints are a little bit thicker as they're growing in, but that's not bad. I probably wouldn't touch that in a million years. Next space upwards, we get compression from the top, moderate compression, and from the bottom. So we actually discussed how are we going to treat all of these things at the same time. So we have underside compression and top compression, along with underside and top compression. What we did, and we talked about doing a staged approach. Do we decompress from underneath because that has the most area of compression to the spinal cord, and it's the more acute change as well. The bony changes, this Wobblers disease and the growth inwards has been there for years, and it's just been slowly getting worse, and now you have disc material that bulges up again. So we did an anterior approach coming from underneath our neck, and opened up both spaces where there's compression and removed the material from underneath, taking the spinal cord from being squished to nice and relaxed and relieved. Because there's this malformation between C6, 7 where it's fused, and it puts more pressure on that adjacent spot on C7, T1, we also fused our spine together. We put a plate in with screws to prevent any more motion that could lead to worsening and have those bones grow inwards even further. Now, by fusing, it does put a little more strain up ahead, but at Soraya's age and with her clinical condition, I don't think it's going to lead to a problem anytime soon. The problem now is we do have a component where we have compression from the top. So just by taking the pressure off from below doesn't necessarily relieve the pressure from the top, because that structure is still present. Do we have to go in at a later date and do a second approach from the dorsal aspect, from the back of her neck? It is possible, because she may not have complete relief and improvement clinically by the first procedure that we've done. But so far she's doing great and is exactly where she was beforehand, with steroids, standing, walking. Doesn't look pretty. She looks pretty, but her walking doesn't look pretty. But my anticipation is she'll get there, and hopefully we don't have to do anything more in the future. But there is a chance that we have to open up the top to relieve the compression from that angle as well. But only time will tell. But I'm always optimistic. I think she's going to be a great puppy.
Great.